Welcome back, everybody. It's U Rehab. Today we are going to be working on sciatic nerve, which refers pain down the leg and into the outside of the leg or the calf muscle. Most often it's from the low back and from the hip. The sciatic nerve runs underneath the piriformis muscle in like most people, and so it's not even a big muscle. And what happens is it gets tight, spasms down, and actually then creates the symptoms. So having somebody work in your hip right into the socket, not into the socket, but the pocket where it's softer, and right below the hip, lateral to the hip, is where you're going to find the piriformis muscle. So.
Yeah, you found it.
What's the pressure?
Hmm?
What's the pressure like?
Oh, 3.
Okay. If I move.
4.
Because like, when you move back
5.
and forth, when you move back and forth, it actually enhances the method of treatment. Lots of times static pressure is good. Other times you can just be a micron away from it, and you need to actually move in order to get in there and get rid of it.
5.
Okay.
6. Okay, it's down to 4.
Okay. What about that?
5, 4.
Okay. Tolerable.
3. 4.
Any referral into your leg at all?
No.
Okay.
I love scapula.
your hip into your left scapula. That's a odd direction. But not everyone is made the same. We are, but we aren't.
6.
Motor point, but with movement. Circular, sometimes transverse across the fibers. The method of James Sciatic does cross fiber friction.
8. Okay, it went me down to like a 2. 3, 4. Feel it in my calf a little bit.
Okay. There. You know that when you do get referred pain, you want to actually mimic the pain the person has, so that way you know that you're in the right area. And oftentimes the area of impingement is far away from where the pain is referred. Like most people get it in their calf and then the side of their leg, with no pain in their butt or their hip, but and then it can be from the low back and on down. But areas that sometimes feel good and they don't hurt at all directly are the areas of actual impingement, and then the results, the symptoms, are directed elsewhere. Any referral at all?
Maybe a little bit in my toes.
Okay. Okay.
Sorry.
Oh, you're fine. The lightning move from one area to another, and wham! Fly off the table. Nice, not right there. Adhesion. Good.
No, it's okay. can feel that going down inside of my thigh.
Okay.
Closer to my crotch.
Mm-hmm.
Hmm. 7, 8. Oh,
Just local, or is it going anywhere?
it's just local.
Okay.
Oh, fire.
Okay.
Biting.
So you've got a lot of adhesions around your hip socket,
It's,
and your socket's over here, but the PSIS, posterior superior iliac spine, and the crest, there's not a lot of trigger points. And again, because you're right here by the sacrum, and the sacrum can tilt any direction it wants to and pinch. So lots of times we do like stretching traction before the piriformis and tilting it whichever direction we want it to go in order to relieve pain and impingement in the low back.
it's like a 2, 1 now.
Okay.
And that's a 7. Man.
Okay.
Jump off it. Try to be a good patient.
I know you are. You're a good patient.
Oh, ugh.
Number 7, 6.
It's down to a 4 now.
Okay.
But it started out like about 7 or 8.
Yeah. Okay. What's that?
2, 3.
Okay.
I haven't actually fallen on it, but I've fallen on my knee on that side a couple of times.
Well, yeah, that would
Years.
certainly set it off.
Maybe that's what.
Tender at all?
Mm-mm.
No? Right here.
No. Doesn't hurt.
Okay.
No. Getting close.
Yeah.
There he is. It's lessening.
Because I'm getting weaker. My power is leaving my body.
I could. You're starting to tremble a little bit. Oh, sheesh. Lightning up my back.
Is it?
It was just for just flex. Right there, in there. Quick, streaking pain up my back. Big, not clear to my scapula a bit about where my bra is. Ooh.
Yeah.
Stuck my finger in the light socket.
Okay, here I'm working on, it's like L1, T12 junction, of course, which is a pivotal, it's a joint, the axis there, just like L5 and S1. Sometimes the problem is above that though. So that pivotal T12 L1, it can be clear up at, you know, T11, T10, where the tightness is, where it's out of balance. And once you loosen that, you get rotational motion there, then it'll free up the T12 L1 junction. So like,
Yikes. It's the same. It's down to a 2.
right there.
It's just uncomfortable. It doesn't. Peeing.
Yeah, but you're really tight right here. May not feel a thing, but
Yeah.
it's definitely bound up. Lots of times muscles won't actually be painful. The ones that are actually causing the problems, they won't even be painful to the touch. So you got to know your tissues and
Oh, yikes.
how they feel in order to make sure you're getting the release that you want. Like that muscle in the back, or spinalis and semispinalis just started shaking and they're letting go. What number is that now?
3.
Yeah.
That's going into a 4.
Okay. I work from the side down, so when the patient's laying on their side, I go in straight down into the laterally to the low back muscles of the low back. Of course, it's better and easier if they're face down and you can get in there and work, but I try to like leave the patient in the exact same position that's comfortable to them, so I'm not really moving them around much.
Okay, I need a break. Oh.
Here I'm just broad and palming the low back muscles. Just moving back and forth across them, helping the patient to feel more comfortable after being tortured, and then to help release them by that natural motion.
That's a hot spot right there. Back toward you a little bit.
Right there.
And you're off of it. There you go. Right there. No.
Okay.
Whew. Yikes.
That's the edge of the sacrum.
Burning, burning, burning. Feels like I touched the hot kettle. It's still burning.
Good, stretching it. And then pushing the sacrum laterally to the right. You all right?
Smart. Oh, oh.
Here I'm on the edge of the sacrum.
Yeah.
Oh, sorry. Come on, I'm backing off. What is that now?
Oh, it's probably a 4 now,
Okay.
but it was a 19.
19. Sorry about that. I just moved like a fraction of an inch.
I know, that's all it
takes. I know that's why sometimes when you're hunting motor points and you're trying to find the areas of dysfunction and all that, your hands have to be really well. They have to be knowledgeable and be able to palpate. And you have to have good palpation skills, knowing what you're actually feeling. Because I mean, you can be, like I said, just a micrometer away from something, and you just slightly move, and the pressure all changes, and then bam, you're on something that's very, very, you're actually on the hot spot, the spots that you're looking for.
There it goes again. Feels like 9 o'clock on a clock.
Oh, okay. Sorry.
No, I mean in position.
Oh.
Like if you moved.
Yeah.
Man, that burns. Oof. Thanks for letting up.
Mm-hmm. Remember, you gotta throw those numbers at me so I know.
I forget sometimes.
Well, sometimes my skills in noticing whether someone's
Tensing up so much.
Or jump off the table. No, we don't want that. It defeats the purpose. Too hard?
No, that doesn't hurt.
Okay.
You're getting closer. Oh, it's probably a 7.
Okay.
6, 5, 4, 3, 2.
That's good. The pain diminishes. You find a trigger point, sit on it, and as the muscle releases, the pain number goes down. So from 10 the worst, 1 the least, it will go down.
Unless you're
like
size
19. Yeah, then it's like 18, 17, 16.
Oh, yikes. It's, it was an 8, but it's down to 5. 4. 3, 2. Oh, man, that is so sore.
Well, hopefully you'll have less leg pain today.
I'm not sure what to do all the walk.
No, we need to do it more often though. It's the key. Okay, roll over onto your back, and I'm going to stretch that right hip out, that left hip out. Now, I'll leave that there for that right there. Go ahead and push your leg down just a little bit. Good. Relax.
Am I supposed to breathe?
Yeah, take a deep breath in. Deep breath. Hold it. Push down. Relax. This doesn't hurt your groin, does it?
Mm-mm.
Okay. Push out to the left side now. And relax. And take a deep breath. Push out to the left side. And relax. Feel right? Do you feel stretching in the hip?
Yeah.
Okay, one more time. Deep breath. Hold it. Push out to the side. Now down. Push down and relax. Oh, I'm sorry. Is it where my hand is or the stretch?
No.
Oh, it's getting your groin.
Yeah.
Yeah, you always have to like shift stuff around when you do that. It's better to go up like that and then over. Did you feel that your hip at all?
No. No, I feel
In the
it.
groin again?
I feel it right here.
Okay.
You know, my body's a little bit stiff. I'm not.
Your hamstrings are nice and not tight or anything. Just push your leg down, just the ground.
Down?
Yeah, relax. And push down towards the ground. And relax. Push down again. Relax. You feel that stretching in there at all?
I feel it back here.
Yeah. Okay, deep breath. Hold it and push down. And relax. One more time, we're just going to take a deep breath and push all the way to the ground. And push all the way down. Good, good, good. Relax. Okay, well that's the end of the session for the sciatic nerve. And we'll work on her a few more times this week and get her back to where she's not being tormented anymore. So thanks a lot, you guys. Have a good day. You rehab out.
That's going to be a long video.
The last one we did was 20 minutes.